Wellbutrin or bupropion. Super common medicine. It's kind of a class of its own NDRI, or a norepinephrine dopamine reuptake inhibitor. It can be safely taken alongside SSRIs, SNRIs. So it's a very strong inhibitor at CYP2D6. So you want to be cautious of other medicines that do this, such as like a Prozac or an aripiprazole or a Abilify. You want to be very, very cautious of people that have a seizure history, because this can lower the seizure threshold. It's a stimulating antidepressant, so it should be taken in the morning most of the time. And it also can be used for, interestingly enough, smoking cessation. And actually, there's some off-label studies for Wellbutrin and naltrexone for methamphetamine use. So like I said, this is a stimulating antidepressant. So what I mean by that is, like I said, it should be taken in the morning, but also it has that norepinephrine activity. I've seen at higher doses, 300 to 450 milligrams, it can help with off-label ADHD treatment, but it's also a really good medication for motivation and energy. So adding this alongside an SSRI, SNRI, if that patient has that fatigue or low energy, can be super helpful. It also has less of a risk for those sexual side effects that you see that can be caused by antidepressants. So like the low libido, that happens about 30-ish% of the time with the SSRIs, SNRIs. So it can be added to one of those medicines if a patient is doing really well on, let's say, Lexapro. Adding a 150 or 300 of Wellbutrin can help kind of counteract those sexual side effects. So neurobiologically, what this medication is doing is it's blocking NETs, or norepinephrine transporters, in the prefrontal cortex, where that's causing an increase in both norepinephrine and dopamine in this area of the brain. This medication also blocks DATs, which are dopamine transporters, but those are not present in the prefrontal cortex, but they are in the nucleus accumbens. A couple things that can happen with this medicine. One is a little bit of a low appetite or a suppressed appetite. Two is sometimes if a patient has a lot of anxiety that is not managed, this medicine can actually increase anxiety, because like I said, it has that norepinephrine component, and so it can be a little bit stimulating. So I'm very cautious about prescribing this medicine with someone with anxiety. Overall, I really like Wellbutrin. It's a good medicine to prescribe, especially adjunctively with other medicines, and it's pretty typically well tolerated across the board.